Welcome. Today we will be diving into the basics of pharmacology. This session will cover what pharmacology is, its scope, and a fundamental definition of what constitutes a drug. Let's explore these concepts in detail. What is pharmacology? Pharmacology is the branch of medicine and biology that focuses on the study of drugs and their effects on living organisms. Study of drugs. Pharmacology involves understanding how drugs interact with biological systems. This includes studying their chemical properties, biological effects, therapeutic uses, and mechanisms of action. Actions of drugs. This aspect looks at how drugs affect the body, including both therapeutic effects, how they help, and side effects, unintended effects. Uses of drugs. Pharmacology examines the various applications of drugs in treating, preventing, and diagnosing diseases. Properties of drugs. This includes studying the physical and chemical properties of drugs, such as their solubility, stability, and formulation. Origins of drugs. Pharmacology also explores the sources of drugs, whether they are derived from natural sources such as plants, animals, or synthesized in laboratories. Example, studying how a pain reliever like ibuprofen reduces inflammation and pain, its chemical structure, how it should be administered, and its potential side effects. Next, what is a drug? A drug is any substance that causes a change in the body's function and or structure. Changes in the body's function. Drugs can alter various bodily functions. For example, they can affect the cardiovascular system by lowering blood pressure or the nervous system by alleviating pain. Changes in the structure. Some drugs can cause physical changes in the body's structure, such as antibiotics that destroy bacterial cell walls. Therapeutic effects. Drugs are often used to achieve specific therapeutic outcomes, such as reducing symptoms, curing diseases, or preventing health issues. Potential for misuse. It's important to understand that while drugs can have beneficial effects, they can also be misused, leading to adverse effects and dependency. Example, antibiotics like penicillin kill bacteria to treat infections, whereas caffeine is a stimulant that affects the central nervous system, increasing alertness and wakefulness. In summary, pharmacology is a vital field that encompasses the study of drugs, their actions, uses, properties, and origins, A drug is any substance that can cause changes in the body's function or structure. Understanding this basic concept is essential for exploring more advanced topics in pharmacology and for appreciating the role of drugs in medicine. Thank you for joining this session, and I look forward to our continued exploration of pharmacology. Welcome students. In today's session, we will explore the various sources of drugs. We will look at how drugs are derived from plants, animals, minerals, and synthetic processes. Let's delve into these categories and understand their significance. First one is plant sources. In the plant sources, drugs derived from plants utilize various parts such as leaves, roots, and flowers to produce medicinal compounds. Leaves of eucalyptus. Eucalyptus leaves are commonly used to make remedies for colds. The oils extracted from the leaves have antiseptic and decongestant properties. Tobacco. While primarily known for its use in cigarettes, tobacco plants contain nicotine, which has both stimulant and medicinal properties. Example: eucalyptus leaves are used to produce eucalyptus oil, which can be found in cough syrups and decongestants. Nicotine extracted from tobacco is used in nicotine replacement therapies to help people quit smoking. Second one is animal sources. Drugs derived from animals often involve extracting substances from animal organs or tissues. Sheep thyroid. The thyroid glands of sheep are a source of thyroxine, a hormone used to treat hypothyroidism. COD liver. COD liver oil is a rich source of vitamins A and D, which are essential for maintaining healthy vision, skin, and bones. Example: thyroxine used in hormone replacement therapy for individuals with hypothyroidism. COD liver oil used as a dietary supplement to provide essential vitamins and support overall health. Third source is mineral source. Drugs derived from minerals involve using naturally occurring elements or compounds found in the earth. Iron. Used in the treatment of iron deficiency anemia, a condition where the body lacks enough healthy red blood cells due to insufficient iron. Iodine, used as an antiseptic to clean wounds and prevent infections. Iodine supplements are also used to prevent iodine deficiency. Examples: iron supplements commonly prescribed to treat anemia and improve hemoglobin levels. Iodine applied topically to disinfect cuts and abrasions, also used in iodized salt to prevent iodine deficiency. Last one is synthetic sources. Synthetic drugs are chemically engineered in laboratories by altering the chemical structure of natural substances or creating entirely new compounds. Altered natural nucleus. Synthetic drugs often start with a natural substance's chemical nucleus, which is then modified to enhance its efficacy or reduce side effects. Common synthetic drugs. Many modern drugs such as anti-anxiety medications and anticonvulsants are synthetic. Examples: anti-anxiety drugs, benzodiazepines are synthetic drugs used to treat anxiety disorders. Anticonvulsants, medications like phenytoin and valproate are used to manage seizure disorders. In summary, drugs can be derived from a variety of sources including plant, animal, minerals, and synthetic processes. Each source offers unique benefits and plays a crucial role in developing effective treatments for various health conditions. Understanding these sources helps us appreciate the diversity and complexity involved in drug development. Thank you for joining today's session, and I look forward to our next exploration in the fascinating world of pharmacology. Welcome in today's session. We will explore the different types of drug names and their significance. We will discuss chemical names, generic names, and brand names using Vicodin as an example to illustrate each type. Let's dive in. First one is chemical name. The chemical name of a drug provides a detailed description of its chemical composition and molecular structure. The chemical name offers a precise description of the drug's chemical structure, detailing the exact arrangement of atoms and molecular components. This name is primarily used by manufacturers and pharmacists who need to understand the exact chemical makeup of the drug. Example: Vicodin. The chemical name for Vicodin is 4,5-alpha epoxy 3-methoxy 17-methylmorphinan 6,1 tartrate 1:1 hydrate 2:5. This complex name describes the specific molecular structure of active ingredients in Vicodin. Second one is generic name. The generic name is the official medical name assigned to a drug, usually by the manufacturer who developed it. It is often a simplified derivative of the chemical name. The generic name is the standardized name that is recognized globally and used in scientific literature and medical contexts. It is often a shorter and more manageable version of the chemical name, making it easier for healthcare professionals to use and communicate. Example: Vicodin. The generic name of Vicodin is hydrocodone and acetaminophen. This name highlights the two active ingredients in the drug, simplifying the chemical complexity for easier reference. Third one is brand name. The brand name is the name under which a pharmaceutical manufacturer markets the drug. This name is owned by the manufacturer and can vary between companies. The brand name is used for commercial purposes and is often easier to remember and pronounce than the chemical or generic name. A single generic drug can be marketed under various brand names by different companies, leading to multiple trade names for the same medication. Example: Vicodin is marketed under several brand names, including Lucozade, Losec, Lotep, Mexidone, Norco, and Vicodin itself. These brand names are owned by different pharmaceutical companies, all referring to the same generic drug combination of hydrocodone and acetaminophen. Conclusion: in understanding the different names of drugs, chemical, generic, and brand is crucial for healthcare professionals and patients alike. The chemical name provides a detailed molecular description. The generic name offers a standardized and simplified reference, and the brand name is used for marketing and commercial purposes. Each type of name serves a unique role in the world of pharmacology and medicine. Thank you for joining this session, and I look forward to our continued exploration of drug-related topics. Welcome. In today's session, we will explore the various routes through which drugs can be administered. Understanding these routes is essential for ensuring that medications are delivered effectively and safely. Let's delve into each route and its significance. First one is oral route. The oral route involves taking drugs by mouth, where they are swallowed and absorbed through the digestive system. This is the most common and convenient method of drug administration. Drugs are absorbed through the stomach and intestines into the bloodstream. Example: tablets and capsules. Common forms of oral medications include tablets and capsules, which are easy to take and widely used for various conditions. Sublingual route is second one. The sublingual route involves placing the drug under the tongue, where it dissolves and is absorbed directly into the bloodstream. This route allows for quick absorption as the drug bypasses the digestive system. Commonly used for medications that need to act quickly, such as nitroglycerin for angina. Example: nitroglycerin used to relieve chest pain, angina, by quickly dilating blood vessels. Third one is buccal route. The buccal route involves placing the drug inside the cheek, where it dissolves and is absorbed through the mucous membranes. Similar to the sublingual route, but the drug is placed in the cheek, bypasses the digestive system for faster onset of actions. Example: buccal tablets used for medications like buprenorphine, which can be absorbed directly through the cheek lining. Fourth one is topical route. The topical route involves applying ointments, creams, or patches directly to the skin, where the drug is absorbed. Ideal for treating specific areas of the skin. Generally, the drug acts locally with minimal absorption into the bloodstream. Example: hydrocortisone cream used to reduce inflammation and itching on the skin. Inhalation route. The inhalation route involves breathing in the drug, which is then absorbed through the lungs. Provides quick relief as the drug is absorbed directly into the bloodstream through the lungs. Commonly used for respiratory conditions like asthma. Example: inhalers used to deliver medications like albuterol to open airways. Next one is vaginal route. The vaginal route involves inserting drugs into the vagina, where they are absorbed through the vaginal walls. Often used for treating local infections or hormonal therapies. Simple application and effective for conditions affecting the vaginal area. Example, vaginal cream and suppositories used for yeast infections or hormone replacement therapy. Next one is rectal route. The rectal route involves inserting drugs into the rectum where they are absorbed through the rectal walls. Useful when oral administration is not possible. Example, vomiting. Bypasses the digestive system for faster action. Example, rectal suppositories used for nausea, vomiting or pain relief. Last one is parenteral route. The parenteral route involves injecting drugs directly into the body, bypassing the digestive system. Provides rapid and precise delivery of medications, includes several subroutes depending on the injection site. Subroutes are, first one is ID, intradermal, injected into the dermis, the second layer of skin, used for allergy test and tuberculosis screening. Second subroute is SC, subcutaneous, injected into the subcutaneous layer, the third layer of skin, used for insulin and other medications that require slow, sustained release. Next one is IM, intramuscular, injected into a muscle, used for vaccines and medications that need to be absorbed quickly. Last one is IV, intravenous, injected into a vein, provides immediate effect as the drug enters directly into the bloodstream. Not only registered nurses or above can perform IV injections. Conclusion, the route of drug. In summary, the route of drug administration plays a crucial role in the effectiveness and speed of medication delivery. Each route has its specific applications and advantages, ensuring that drugs can be administered in the most suitable and efficient manner for the patient's condition. Understanding these routes helps healthcare professionals choose the appropriate method for each situation. Thank you for joining this session, and I look forward to our next topic in the fascinating world of pharmacology. Hello everyone, welcome to today's session. We will discuss the routes of administration and the factors that determine which route is chosen for a particular drug. Understanding these factors help ensure that medications are delivered effectively and achieve the desired therapeutic outcomes. Let's explore the key factors that influence the choice of route. Route depends on the several factors. First one is type of drug. Type of drug means the physical and chemical properties of a drug play a significant role in determining its route of administration. Drugs that are soluble in water may be suitable for oral or intravenous routes, whereas lipid-soluble drugs might be administered topically or intramuscularly. Some drugs may degrade in the stomach's acidic environment, making oral administration unsuitable. Such drugs might be given intravenously or sublingually. Drugs that can irritate the gastrointestinal tract are often administered through non-oral routes to avoid adverse effects. Example, insulin. Insulin is a protein that would be broken down in the digestive system, so it is administered subcutaneously. Second one is dosage form. The form in which a drug is produced, such as tablets, capsules, injections, creams, or inhalers, influences its route of administration. Solid forms, tablets and capsules are typically administered orally. Liquid forms, solutions and suspensions can be taken orally, injected or inhaled. Semi-solid forms, creams and ointments are applied topically. Gaseous forms, inhalers and aerosols are used for respiratory conditions. Examples: inhalers used for asthma, medications in the form of aerosols to deliver the drug directly to the lungs. Third one is intended action. The therapeutic goal of the drug, whether it is meant to act locally or systematically, determines the appropriate route of administration. Local action. Drugs intended for localized effect are administered directly to the target site. For example, topical creams for skin conditions. Systematic action. Drugs intended for systemic effect are administered in a way that allows them to enter the bloodstream. Example, oral or intravenous. Example, topical antibiotics applied directly to the infected area for localized treatment without significant systemic absorption. Last one is rapidity of response desired. It means the speed at which the drug needs to take effect influences the choice of administration route. Rapid response. For conditions requiring immediate relief, routes like intravenous or sublingual are preferred as they provide quick absorption. Slow and sustained response. For chronic conditions, routes like oral or transdermal patches are used for sustained release over time. Example, nitroglycerin sublingual tablets used for quick relief of angina pain due to their rapid absorption under the tongue. In summary, the choice of drug administration route is influenced by several factors, including the type of drug, its dosage form, the intended action, and the desired rapidity of response. By considering these factors, healthcare professionals can ensure that medications are administered in the most effective and appropriate manner for each patient's needs. Thank you for joining this session, and I look forward to our next discussion.
Hello everyone, welcome to today's session on how medications are given. Understanding how medications are provided to patients is crucial for ensuring they are used safely and effectively. There are three primary methods through which medications are given to patients. They are prescribing, administering, and dispensing. Let's break down the three primary methods by which medications are given to patients. First one is prescribe. Prescribe means when a healthcare provider prescribes a medication, they write an official order that the patient takes to a pharmacy to have the medication prepared and provided. Written order means this order includes the name of the drug, the correct dosage, the route of administration, how the drug should be taken, the frequency, how often it should be taken, and the duration, how long the patient should take the drug. Patient responsibility means Once the prescription is written, it is the patient's responsibility to take this order to a pharmacy. The pharmacist then reads the prescription, prepares the medication and provides it to the patient. Legal professionals. Prescriptions are legal documents and they must be accurately written and include all necessary details to avoid errors. Example, if a doctor prescribes antibiotics for an infection, they will provide a written prescription that the patient takes to the pharmacy. The pharmacist then fills the prescription according to the doctor's instructions. Second one is administer. Administer means administering a medication means that a healthcare professional gives the drug directly to the patient in a clinical setting. Direct delivery. In this method, the medication is given to the patient by a nurse, doctor or other healthcare provider while the patient is in the medical office, clinic or hospital. Why it is important? This method is often used for medications that need to be administered in a controlled environment to ensure proper dosing or to monitor for immediate reactions. This could include injections, intravenous infusions or oral medications given during the appointment. Example, when a patient visits a clinic for a flu shot, the nurse administers the vaccine by giving the injection directly to the patient. Last one is dispense. Dispensing a medication involves giving the patient a drug to take later either at home or as needed. Method, the healthcare provider provides the medication directly to the patient, often as a sample or pre-packaged dose. Patient's instructions. Along with the medication, the patient is given clear instructions on how and when to take the drug. Convenience and compliance. Dispensing is useful when the patient might not be able to get to pharmacy immediately or when the healthcare provider wants to ensure the patient begins the medication right away. Example, a doctor might dispense a few sample tablets of a new medication for a patient to start immediately with instructions to continue the course once they have filled the prescription. In summary, these three methods, prescribing, administering and dispensing, are essential for ensuring that patients receive the right medications at the right time. Prescribing involves giving the patient a written order for the medication. Administering is about directly giving the drug to the patient in a healthcare setting. And dispensing involves providing the medication to the patient to take later. Each method plays a crucial role in patient care and medication management. Thank you for joining on this today's session. Welcome to our session on the Controlled Substances Act. Today we will be diving into an important piece of US legislation that has a significant impact on how drugs and other substances are regulated. The Controlled Substances Act, commonly referred to as the CSA. Understanding the CSA is crucial for anyone involved in healthcare, law enforcement, or drug policy. What is Controlled Substances Act? The CSA was enacted in 1970 as part of the broader Comprehensive Drug Abuse Prevention and Control Act. The purpose of this legislation is to regulate the manufacture, importation, possession, use and distribution of certain substances. The goal is to prevent drug abuse while ensuring that drugs with legitimate medical uses are accessible to those who need them. Drug schedules. One of the key features of the CSA is its creation of 5 different drug schedules or classifications. Each schedule categorizes substances based on their potential for abuse, their accepted medical uses, and their safety. Schedule 1 drugs have the highest potential for abuse and no accepted medical use in the US. These include substances like heroin and LSD. Schedules 2 drugs also have a high potential for abuse, but they do have accepted medical uses. Examples include morphine and oxycodone. However, misuse of these drugs can lead to severe psychological or physical dependence. Schedules 3 drugs have a lower potential for abuse compared to Schedules 1 and 2, with moderate to low physical dependence or high psychological dependence. An example would be anabolic steroids. Schedules 4 drugs have a lower potential for abuse and include medications like diazepam. Schedules 5 drugs have the lowest potential for abuse, often consisting of preparations with limited quantities of certain narcotics such as cough medicines with small amounts of codeine. Role of federal agencies. 2 key federal agencies are responsible for enforcing and managing the CSA: the Drug Enforcement Administration and the Food and Drug Administration. The Drug Enforcement Administration ensures compliance with the CSA, while the Food and Drug Administration, in collaboration with the Drug Enforcement Administration, determines which substances should be added to or removed from the controlled substances schedules. When making these decisions, the agencies consider several factors, including the substance's potential for abuse, its accepted medical use in the United States, and its safety profile in terms of causing dependence. Why is the CSA important? The Controlled Substances Act plays a vital role in public health and safety by ensuring that drugs are used properly and that those with a high potential for abuse are strictly regulated. Healthcare professionals must follow the CSA's guidelines when prescribing, dispensing, or administering controlled substances to ensure these substances are used safely and effectively. Violating the CSA can result in serious legal consequences, including fines and imprisonment. Therefore, understanding and adhering to the CSA's regulations is essential for anyone involved in the handling of controlled substances. To sum up, the Controlled Substances Act is a crucial piece of legislation that helps balance the need to control drug abuse with the necessity of making important drugs available for medical use. By understanding the CSA, we can ensure that we are contributing to a safer and healthier society. Thank you for joining me in this session. Where we will be diving into the Controlled Substance Act. This legislation is a cornerstone of drug regulation in the United States and plays a crucial role in how certain substances are managed and controlled. The Controlled Substance Act was enacted by Congress in 1970. It forms the basis of drug policy in the United States, regulating the manufacture, importation, possession, use and distribution of certain substances. The purpose of the CSA is to help control and prevent drug abuse while ensuring that medications with legitimate medical use remain available to those who need them. To achieve this, the CSA classifies drugs into 5 different schedules based on their potential for abuse, their accepted medical use, and the
Likelihood of causing dependence. Let's explore each of these schedules in detail. Schedule 1. Schedule 1 drugs are considered the most dangerous under the CSA. They are characterized by having no currently accepted medical use in the United States and have high potential for abuse. These drugs are tightly controlled because of their potential to cause severe psychological or physical dependence. Some examples of Schedule 1 drugs include heroin, LSD, marijuana, ecstasy, meth, and peyote. Because of their high risk, Schedule 1 drugs are not available for medical use and their distribution is highly restricted. Schedule 2 drugs. Next we have Schedule 2 drugs. These substances have a high potential for abuse, though less than Schedule 1 drugs, and they are considered dangerous. However, unlike Schedule 1 drugs, they have accepted medical uses, albeit with severe restriction. Some examples include cocaine, methamphetamine, methadone, oxycodone, and fentanyl. These drugs are used in medical settings, particularly for pain management, but they require careful monitoring because of their potential for severe dependence. Moving on to Schedule 3 drugs, these substances have a moderate to low potential for physical and psychological dependence compared to Schedules 1 and 2. Their abuse potential is lower, but it's still significant enough to warrant control. Examples include Vicodin, Tylenol with codeine, ketamine, and anabolic steroids. These drugs are used in various medical treatments from pain relief to hormone therapy, but they must be prescribed and used responsibly. Schedule 4 drugs have an even lower potential for abuse and a lower risk of dependence. These drugs are commonly prescribed for anxiety, insomnia, and other conditions where the risk of dependence is relatively low. Some examples are Xex, Valium, H1, and Ambien. These medications are widely used, but like all controlled substances, they should be taken under the guidance of a healthcare professional to avoid misuse. Finally, we have Schedules 5 drugs. These substances have the lowest potential for abuse among the controlled substances and consist of preparations containing limited quantities of certain narcotics. Examples include cough preparation with small amount of codeine like Lomotil and Lyrica, which are used for antidiarrheal, anti-tissue, and analgesic purposes. These drugs are the least regulated but are still controlled to prevent abuse. In summary, the Controlled Substance Act is a vital tool in balancing the need to control drug abuse with the necessity of making medications available for legitimate use. By classifying drugs into these schedules, the CSA helps ensure that healthcare providers can prescribe drugs safely, patients can use them appropriately, and society can protect itself from the dangers of substance abuse. Thank you for your attention. Hello everyone and welcome to today's lesson. We are diving into an essential topic in healthcare and pharmacology, understanding the parts of a prescription. This knowledge is fundamental for anyone involved in the medication management process. Let's break down each component of a prescription and its significance. First, let's briefly revisit what a prescription is. A prescription is a written order from a healthcare provider that instructs the compounding, dispensing, and administration of a particular drug to a specific patient. It's a crucial document in ensuring that medications are accurately and safely provided. Parts of prescription. First one is physician's name, address, telephone number, and fax number. This information is pre-printed on the prescription form. It includes the physician's contact details, which are essential for the pharmacist if there are any questions or clarifications needed about the prescription. Importance of this part: it ensures that any issues or queries can be promptly addressed by contacting the provider's office. Second one is date. The date on the prescription is crucial because the pharmacist cannot fill a prescription without it. Prescriptions generally expire after a specific period, usually 1 year, except for controlled substances which have stricter timelines. Important of this part: it helps in checking the validity of the prescription and ensures that medications are not dispensed past their intended usage period. Third one is patient's name and address. This part of the prescription includes the patient's personal information such as their name and address. It is used for insurance billing purposes and ensures that the medication is dispensed to the correct individual. Fourth one is patient's age. The age of the patient is included to assist in dispensing the correct dosage. It ensures that the medication is appropriate for the patient's age group, which is crucial for safety and efficacy. Next one is superscription. This includes the simple Rx, which is Latin for receipt and means take. It indicates that the following instructions are for preparing a medication. Sixth one is inscription. This section contains the name, form, and strength of the drug. Example, for a drug like amoxicillin, it might be written as amoxicillin 250 mg. It specifies exactly what medication and dosage are to be provided. Next one is subscription. These are the instructions to the pharmacist on how many doses of the medications to dispense. To prevent alterations, quantities are often written using both numbers and words. You can see the example in this slide. First we can indicate the number, and also we can mention the name of that number. Next one is signature. Sig is Latin for write or label and includes the directions for the patient on how to take the medication. Importance is it ensures the patient knows how to properly use the medication at home. You can see this example. How can we write? Take 1 POQD. It means take 1 by mouth daily. These are the abbreviation which is used in the pharmacology. Next one is refill. This specifies how many times the prescription can be refilled. Its importance is it helps in managing medication supply and ensures proper adherence to the treatment plan. Another one is physician signature. A prescription must be signed by the physician to be valid. Importance is the signature confirms that the prescription is authorized and legitimate. Last one is DEA number. This is a unique number required for prescriptions of controlled substances. Importance is it ensures compliance with regulation governing the distribution of controlled drugs. In conclusion, understanding these components of a prescription is essential for ensuring the correct and safe administration of medications. Each part of prescription serves a specific purpose and contributes to the overall process of medication management. Thank you for joining today's lesson. Hello everyone, and welcome to our session on the Physician's Desk Reference or PDR. Today we are going to explore what the PDR is, its significance and how it's organized. Understanding the PDR is essential for anyone involved in the healthcare or pharmaceutical, as it's a critical resource of drug information. What is the Physician's Desk Reference? The Physician's Desk Reference, commonly known as the PDR, is a comprehensive resource used primarily by physicians and other healthcare professionals. Its primary purpose is to provide detailed information about prescription drugs. This includes data on the drug's effects, uses, and potential side effects. The PDR is invaluable for healthcare providers who want to make informed decisions about medication and treatment plans. Why is the PDR important? The PDR is essential for several reasons. First one is identification. It helps in identifying thousands of prescription drugs. Next use is drug effects. It provides comprehensive details on how drugs work, including their therapeutic and adverse effects. Last important is reference. It serves as a key reference for healthcare professionals and anyone interested in understanding specific medications. The PDR is organized into several sections, each serving a distinct purpose. Let's take a closer look at each of these sections. Section 1. Manufacturer's Index. This section lists all the drug manufacturers. It helps users find information based on the pharmaceutical company producing the medication. Section 2, Brand and Genetic Name Index. This index provides an alphabetical listing of both brand names and their corresponding genetic names. It is useful for locating drugs by their commercial or official names, which can help in cross-referencing different names for the same drug. Section 3, Product Category Index. This section categorizes drugs based on their therapeutic use or product category. It helps users find drugs within specific therapeutic categories, making it easier to understand their intended uses and application. Section 4, Product Identification Guide. This guide contains pictures of each drug showing what they look like. Visual identification of drug is crucial for ensuring the correct medication is dispensed and used. Section 5, Product Information. This section provides detailed information about each drug, including indications, dosage, and side effects. It offers in-depth knowledge necessary for proper drug administration and understanding of potential effect. Last section is Diagnostic Product Information. This section includes information about diagnostic product used in medical testing and procedures. It provides insights into diagnostic tools and their uses in medical practices. In conclusion, the physician's desk reference is a crucial tool in the medical field, offering comprehensive information about prescription drugs. By understanding how to navigate its sections, healthcare professionals can effectively utilize this resource to enhance patient care and safety. Thank you for joining today's lesson.
Hello everyone and welcome to today's lesson on the 7 rights of preparing and administering medication. Understanding and adhering to these 7 rights is crucial in ensuring patient safety and effective treatment. They serve as a fundamental guideline for healthcare professionals to avoid errors and enhance the quality of care provided. Why are the 7 rights important? The 7 rights are designed to safeguard patients by ensuring that medication is administered accurately and safely. Each right addresses a critical aspect of medication administration, from ensuring the correct drug is given to documenting the administration process. Let's explore each of the 7 rights. First one is right drug. What it means: always verify that the medication being administered is the correct drug as prescribed. Importance is administering the wrong drug can lead to adverse effects, ineffective treatment, or severe complications. Always double check the medication against the prescription. Second one is right dose. It means ensure that the dosage of the medication is accurate as per the prescription or medication order. Importance is the correct dose is crucial for the medication to be effective and to avoid overdose or underdose. Use proper measuring tools and verify the dosage carefully. Next one is right time. It means administer the medication at the correct time as specified in the medication order. Its importance is timing can affect the effectiveness of the medication and the patient's condition. Adhering to the scheduled times ensures optimal therapeutic outcomes.
Fourth one is right patients. What it means, confirm the identity of the patient before administering the medication. Its important is to prevent medication errors. Always use patient identifiers such as name, date of birth or medical record number to ensure the medication is given to the correct patient. Right route, it means administer the medication via the correct route, whether it's oral, intravenous, topical or another method. Its important is the route of administration can affect how the medication is absorbed and utilized in the body. Using the right route ensures the medication's effectiveness and safety. Right technique. It means follow the proper technique for administering the medication, including any special instructions for the medication. Its important is correct technique ensures that the medication is administered safely and effectively. It also helps in minimizing discomfort or complications for the patient. Right documents. It means document the administration of the medication accurately and promptly. Its important is proper documentation provides a record of the medication given, which is essential for tracking treatment, avoiding duplicate doses and ensuring continuity of care. In conclusion, following the 7 rights of medication administration is essential for providing safe and effective patient care. These guidelines help prevent medication errors and ensures that each patient receives the correct treatment. Thank you for participating in today's lesson. Remember, adhering to these 7 rights not only ensures patient safety but also enhances the overall quality of healthcare. Keys of checking medication labels. Ensuring the correct medication is administered involves meticulous attention to detail, and checking the medication label 3 times is a fundamental safety measure. Why checking the label is essential? Checking the medication label multiple times is a vital practice in preventing medication errors. It ensures that the right medication is given to the right patient in the correct dosage and form. This practice helps in minimizing risk and enhancing patient safety. The 3 key times to check the medication label. When removing the drug from the cabinet, what to do? As soon as you retrieve the medication from the storage area, check the label carefully. Why it matters? This initial check confirms that you have the correct medication and dosage form. It is the first line of defense against errors, ensuring that you are starting with the right drug. Second one is before preparing medication. What to do before you begin preparing the medication, whether you are measuring, drawing up or otherwise getting it ready for administration, check the label again. Why it matters? This second check helps ensure that the medication is still the correct one as you prepare it for administration. It is an additional safeguard to catch any discrepancies or mix-ups that might have occurred. After preparing the medication but before putting it away, what to do? Once the medication has been prepared but before you put it back in the cabinet or administer it, perform a final checkup of the label. Why it matters? This final check verifies that the prepared medication matches the label and confirms that no errors occurred during the preparation process. It is the last opportunity to catch any potential mistakes before the medication reaches the patient. Conclusion: the practice of checking the medication label 3 times when removing it from storage before preparing it and after preparing it before putting it away is a crucial safety measure in medication administration. This repetitive verification process helps ensure that the medication is accurate, safe, and effective for the patient. Thank you for your attention today. By adhering to these steps, we can significantly reduce the risk of medication errors and contribute to better patient care.
Hello everyone. Welcome to today's lesson on medical abbreviations. Understanding these abbreviations is crucial for accurate medication administration and effective communication in healthcare settings. Let's explore each of these abbreviations and their meanings. First one is Q8H. It's mean every 8 hours. This abbreviation indicates that the medication should be administered every 8 hours throughout the day. For example, if a medication is prescribed to be taken Q8H, it would be taken at 8 a.m., 4 p.m. and midnight. Second one is PO. It means by mouth. This abbreviation specifies that the medication should be taken orally. For instance, if a medication is prescribed as PO, it means the patient should swallow the medication. Third one is STAT. It means immediately. This term is used to denote that the medication or action is required urgently. For example, if a medication is ordered STAT, it must be administered without delay. Fourth one is Q. It means every. It means every. This is a general term used in combination with other abbreviations to indicate frequency. For instance, QD means every day and QID means 4 times a day. Next one is PRN. It means as needed. This abbreviation indicates that the medication should be taken only when necessary, not at scheduled times. For example, a medication prescribed PRN may be taken when symptoms arise, such as pain or nausea. Next one is QD. It means every day. This abbreviation is used to instruct the medication should be taken once daily. For instance, a medication prescribed QD should be taken every day at the same time. Next one is BIT. It means twice a day. This indicates that the medication should be taken 2 times a day, typically with a space of approximately 12 hours between doses. Another one is DIT. Another one is DIT. DTID. DIT. It means 3 times a day. 3 times a day. This abbreviation means the medication should be taken 3 times daily. It often requires doses to be spaced evenly throughout the day. Another one is PC. It means after meals. This instruction indicates that the medication should be taken after eating. For instance, if a medication is prescribed as PC, it should be taken after breakfast, lunch or dinner. Another one is AC. It means before meals. This means the medication should be taken before eating. For example, a medication prescribed as AC should be taken before breakfast, lunch or dinner. Last one is QID. It means 4 times a day. This abbreviation signifies that the medication should be taken 4 times throughout the day. It is often used to schedule doses at regular intervals. Understanding these abbreviations is essential for accurate medication administration and preventing errors. They help ensure that medications are taken at the correct times and in the proper manner. If you have any questions, clarifications, you can ask through the chat. Thank you for your attention. And keep these abbreviations in mind as you continue to learn about the medication administration and patient care.